Thoracic counterstrain points, all of it is extension. There are your midline points that are right between the spinous processes. Then there are your posterior points, which are just next to the spinous processes. And then you have your transverse process, which are going to be these transverse process points laterally. For your midline points, it's purely extension. For your posterior points that are just lateral to the spinous process, that's going to be extend, side bend away, and rotate away. And then for the transverse processes, those are going to be extend, side bend away, rotate towards. That is the main difference there. So as we go and look at the next page, that is midline, just the spinous processes. That is mostly just a pure midline extension point. For the inferior lateral spinous process points, you can, for the upper ones, treat supine and have them extend backwards. I'm going to show you guys like the mid to lower points where you can bring the shoulder, the opposite shoulder, down and towards you. So that is going to side bend and rotate that segment away. Okay, so let's do that one here. So as we can see here, what we have as the midline points are in blue. That is between the spinous processes. The posterior points, which are going to be just lateral to each spinous process, are in red, and then the transverse process points are in orange. So let's say we're treating a PC6 posterior point, which is also inferior lateral to the spinous process at 1, 2, 3, 4, 5, 6. If I'm treating the left side, you're going to be on that same side, but using the opposite shoulder. So the reason we do that is to treat it, I bring this shoulder down, caudad, and towards me. So I'm extending by bringing the shoulder towards me. I'm rotating it away because it's a left-sided point. I'm rotating him to the right, and I'm side bending it away because I'm side bending him right by bringing the shoulder down, caudad, and therefore it's a side bent right part of that spine. So it's rotate away, side bend away, and extend to treat a left-sided posterior lateral point in the thoracic spine. If we're treating the transverse process, again at posterior PT6, so it's going to be 1, 2, 3, 4, 5, 6. Now I'm sitting on the opposite side this time, as opposed to the last technique, I was sitting on the same side. And the reason why is to treat it, we have to rotate towards and side bend away, which is different than the other one we just did. So to do that, I have to bring his shoulder up towards his head to side bend away. To rotate towards that right side and extend, I bring it towards me. So the only real difference with this one is that I'm bringing his shoulder up to his ear, not to his heel, because I'm treating a right-sided transverse process. So again, it's rotating to the right, side bending to the left, and extending. Remember, for the midline points, we said that it was purely extension. Now for the upper midline points, you see in Nicholas, they have the patient in a lot of extension here. This, I find, can be uncomfortable for patients. I think this variation is much, much easier, okay? Although you have to be really treating just PT 1 to 4. Whenever we use the head, it's safe to say that we're treating just maximally down to the 4th thoracic vertebrae. So let's treat it on our patient here. So let's go to the PT1 midline. Remember, this is between the spinous processes. So as I go down here, I see my marker. It's right there. So I'm right in the midline. The patient is that tender. Yes. And then let's have you scoot all the way off. So my hand is off. And you always want to support your patient's head. So I've just got him securely in my lap. Let's come a little bit more off. Yeah, perfect. Now all we have to do, so patient is that tender? Yeah, we'll call that a 10 out of 10. All we have to do, and maybe I just have to lower my stool a little bit. All right, so it's as low as it goes, or you can raise the table, whatever you want to do. And then I just bring him into pure extension here. So I'm really cradling the head. I still have my finger on the point. All right, patient, what would you call that?
3.
A 3. I lower him a little more. What would you call that?
A 2.
A 2, okay. Now, I would probably heighten the table a little bit. I don't want to be hunched over for too long. Maybe I just straighten out my back and scooch my chair back just for my own biomechanics. And then this is a pure extension at a PT1 midline posterior point. Okay, you can scoot back.